Welcome to another edition of Access Higher Ed. I'm your host, Christina Wynn, and we're focusing today on a very important topic that touches not only our community here in the Berkshires, but really beyond. So we have two incredible experts that are joining us today to talk about some of the things that are new and happening in our community that will really be hopefully helpful for families and individuals who live here in the Berkshire. So I'm incredibly excited to welcome to the show Dr. Jennifer Michaels and Dr. Kari Dupuis. So I'm going to let them go ahead and talk a little bit about themselves and their backgrounds and how they came to do the work that we're so lucky that they're doing here in our community. So Dr. Michaels, I'll start with you.
Sure. Well, I've been in the Berkshires about 25 years with the Brien Center and also Berkshire Medical Center. And we've watched a greater need for addiction services, obviously, with this opioid epidemic. So we've been meeting the needs of the community with recovery homes and outreach and medication and day treatment and evening treatment. That's what we do. We focus on the community, and whatever is needed, we're there for them.
That's great. Thank you for doing that kind of work.
It's very gratifying.
Dr. Dupuis.
Yeah, so I head up the Human Services program at Berkshire Community College, and I've been here for 4 years at BCC. And before that, I was a school counselor in the middle school at Herberg Middle School. And I went into this area because I was hearing from my students in the field of addiction that this is an incredible need. And of course, I could see just that this is an epidemic in our community and in our nation, and really felt that this was an area that I really wanted to make sure that we could provide courses and training for students to go out into the field and work in this urgently needed area.
Sure. As we think about, you both mentioned it, the terms opioid epidemic. That's something I think that we're hearing on national levels when you pick up the newspaper or you listen to any sort of cable news. Can you talk a little bit about what that means, the opioid epidemic?
Sure. I guess I'll do that.
Yeah, and then I'll follow up because I have some information.
Sure.
Sure.
Yeah.
We first saw this in the late 1990s when doctors were overprescribing pills for pain, opioid pills, and then it evolved into heroin addiction. And now we are seeing record numbers of people dying from drug overdoses. More people died in 2016 than died in the entire Vietnam War from overdoses.
Wow.
So it truly is an epidemic, and it's an epidemic that I call an equal opportunity epidemic, in that it touches all families. It doesn't matter which side of the tracks you're from. It doesn't matter what degrees you have or what level of education you have. Everyone is affected. So we need to do exactly what you're doing in the college.
Wow.
Yeah.
So in developing the Addiction Recovery Assistance Certificate at BCC, I did some research, and through the Massachusetts Department of Public Health, Bureau of Substance Abuse Services, just to give you an idea of how this epidemic has hit our state and in Berkshire County. In 2016, there were a staggering 2,207 lives lost to the opioid epidemic in our state. And then towns across Berkshire County from 2012 to 2016, Pittsfield lost 73 lives to the opioid epidemic, North Adams 21, Adams 8, and so on. I mean, really no one has been exempt from this, but just to give you an idea. And so I've certainly seen it from working in the community and what students have shared with me about this urgent need. And so we're really very glad that we've been able to. Dr. Michaels was tremendously helpful. I met with her before developing this program, and she was incredibly helpful in terms of giving us ideas about fieldwork sites and just the development of our courses and that kind of thing. So I'm delighted to work together with her.
Yeah, it's
and her
clearly
team.
something that's tackling a huge need here in our region. Dr. Michaels, you mentioned something very interesting. You said that this is an epidemic that touches people on both sides of the track. And when I think the average person, maybe a few years ago, thought about drug addiction, they thought about a certain kind of person, right? And for whatever that means in their own mind. But you're saying now that this is, regardless of education, regardless of socioeconomic situations, that this is being touched. And you mentioned it was because of pain pills. It does seem like a very far cry to go from pain pills to heroin.
It sounds like that, but in my dealing with people struggling with this disease, what I see is lines drawn in the sand. You know, I'll never use every day, and then cross the line. I'll never snort pills, cross the line. I'll never use heroin, cross the line. It's desperation, and also it kind of reflects how addiction evolves. You start out very innocently, maybe experimenting, or your doctor prescribed these pills, and before you know it, you're in the grips of addiction, and so desperate that you do things that you would never do if you were not addicted. And the other thing I want to say, just seeing patients yesterday in my office, it was clear to me that people in addiction are not having a good time, they're not getting high, they're miserable, and they're just trying to feel less bad. And nobody planned to be addicted.
Right. Yeah, that's an excellent point. I mean, as you think about Dr. Dupuis, the relationship between what we're seeing in patients and how we're going to be educating counselors and other professionals, how do you see maybe the argument from folks that, well, addiction, you know, somebody's addicted to drugs, just stop, just don't take them anymore, and it's just sort of just that easy, right?
Right. Well, I haven't seen that, and I don't have the level of knowledge that Dr. Michaels does in terms of the brain, you know, the impact on addiction in the brain. I have some with that, but it is not easy. And I've talked, and again, I'm in private practice too, and so talking with the clients that I work with and the students, that whether they've gone through it or they have family members that have gone through it, it's terribly difficult. Just even the brain chemistry to be able to come off of addiction, it's not something you could just stop. The impact of withdrawal is just tremendous. And then you really need a long-term approach to be able to help you really recover. And so what we're hoping with this Addiction Recovery Assistance Certificate is to be able to provide trained entry-level professionals in the human services field to work in the addiction field, and that is our goal.
Great. When you talk about and you think about that particular program, so can you tell us a little bit about what makes the program up, so the kinds of courses that a student would expect to see, and sort of how long they would expect to be in the program before they could get out and take on some work, some jobs here in our workforce?
Wonderful. Okay, so the Addiction Recovery Assistant is really, it could be completed in 1 year, but maybe it might be more like 1.5 years, but it could be 1 year. It involves courses such as addiction counseling, addiction treatment modalities. There's a drug and alcohol abuse prevention or education course that's taught through our criminal justice program at BCC. We have a 90-hour fieldwork requirement, and so students would be placed, for example, at the Brien Center in their addiction treatment programs, the McGee unit, crisis stabilization services, Tapestry Health with harm reduction, and then we have other sites throughout. We actually have 30 to 35 overall fieldwork sites in our human services program, but we have several specifically focused in addiction recovery. We also we have stackable credits, so a student who comes in for the Addiction Recovery Assistant, many of those courses will be able to be applied for a social work transfer degree, which is an associate's degree in social work. We have a wonderful opportunity at BCC where we have Elms College at BCC. They have a social work program there, and it's a 20-month program on Saturdays. So that means during the week you could be working, being with your family, so forth, and then on a Saturday you would take 2 courses typically, every Saturday. It's pretty intense. But then when you're done with that 20-month program, you have a bachelor's and an accredited social work program. And then you graduate as an advanced standing student and you can complete your MSW in 1 year. So we look at that the Addiction Recovery Assistant is a significant step, but you can use those credits, those stackable credits, towards really moving on to eventually moving on for your associates and bachelor's and then master's in social work.
So it's maybe an approach where you can bite off education, little bits at a
Yes.
time, and if you
Yes.
so desire to go further, which would be wonderful, that you can find ways to do that meet your schedule.
Yes, absolutely. Yeah.
So as you hear Dr. Dupuis talk about the courses and those kinds of things, and you are working in the field obviously every day, and I'm imagining, because you said there's so many numbers now of people that are facing this situation, that you're at a shortage for folks that are trained to be able to deal with it. When you hear about this particular program, how do you see that fitting into the work that you do and hopefully being helpful to you and your team?
I see it fitting in tomorrow, as soon as you have graduates. We're very excited because we need staff. Every day we have more people in need of help, and we don't have enough staff to do the work. So we're thrilled that BCC has taken this on, that it's local. We're thrilled also for our patients, because we have a lot of people in long-term recovery who are seeking this kind of education,
Right.
and we didn't have it locally until this. So that on another level, I think it's incredibly gratifying to see people in sustained recovery deciding to help other people.
Sure. If you're just tuning in, this is Access Higher Ed, and we're today talking about the Addiction Recovery Certificate that will be launched in the fall at Berkshire Community College. We're so thrilled. Today we have with us Dr. Jennifer Michaels and Dr. Kari Dupuis, both who are sharing their experiences both in practice and through education. So, again, thank you so much for being here. As you think about the workforce needs here in Pittsfield, right? So you work for the Brien Center. You've also worked with Berkshire Medical Center. Would you say that the workforce needs for this particular certificate are statewide? Are they throughout the U.S., or is this something that you're feeling really in pockets in large cities?
My understanding is we have a problem with recruitment in the entire state. I don't know about the whole country, but when I go to conferences in the state, people are talking about not having enough people to do the work. We know how to help people. We know how to help people get sober, stay sober, but we need the trained professional staff to do the work. So that's where we are, and it's universal throughout Massachusetts.
So this is really an opportunity where a student can come in and within about a year and a half have a credential that will lead them directly into a pathway in the workforce. And then if they want to take other courses and lead to a bachelor's degree, or as you said, an MSW, there's certainly the opportunity to do that. So we're creating pathways.
Yeah. And I think it's important for people to know that if this field and working in addiction and addiction counseling, it's projected 3 times faster than any of the average fields in professional development. So it's a rapidly growing field, whether we're in Berkshire County or Massachusetts or really nationally. So it's a significant need. And our students, they would be able to work at places such as entry-level positions at the Brien Center, but also, for example, at Construct or Elizabeth Freeman Center or Tapestry Health or other area agencies who have said, because we have a Human Services Advisory Board and we have over 30 members, and several of our members said we would be much more likely to hire an entry-level professional with this ARA certificate compared to someone who doesn't have it, because it's such a significant need in our community.
Absolutely. One of the things that I think I heard you both mention was this notion of an individual who perhaps was facing addiction either personally or perhaps, I guess in this case personally, and has gone through some recovery and is really interested in taking on this program as kind of a way to maybe give back. Can you talk a little bit about your experiences working with individuals who would kind of fit that profile?
Sure, it's actually fairly common. There are people that I've worked with, treated over the years, who were so inspired by their process of recovery. It transformed their lives that they then want to give back. So we have people working at the Brien Center who got help at the Brien Center and stayed with the Brien Center. They went through training, they got certificates, they're running programs, and they inspire us all. We need to hear those wonderful stories of what can happen when people put down substances and enter recovery. So I think that people need to be sober for a long enough period of time to safely enter the educational process. So a minimum of a year, even more of sober time, and to make sure that they have a strong support network. Just because you become a professional doesn't mean you don't need your own recovery support network. That's for life.
Right,
That's right.
absolutely. Then I'm assuming that you're seeing the same things, maybe of folks when you talk about this program who have shared with you, I have a story like this, and
Yes.
I feel like this is the point in my life where I want to be able to contribute back.
Yeah, many students that I talk with that come into human services have had some experience, whether themselves with addiction or a family member with addiction or other issues, and they want to be able to give back because they've been helped. They've had someone or an agency, whatever, services that really turned their lives around. And by their coming to BCC, they're almost really saying, I'm really turning my life around. I'm having a fresh start. And so to be able to give back is very meaningful. And I echo what Dr. Michaels is saying in terms also of making sure that you're really solid in your recovery before going into the addiction field, because you can have triggers, in terms of working with clients or, balancing the stress of being in school and working in the addiction field, so that you're strong in your recovery. That's also very important. But students are really excited about this program, so I'm so glad about that. Yeah.
That's a great point. So I'm thinking, if I'm somebody who is perhaps watching at home and I'm thinking, okay, I've been through this, I've had this situation in my life, I think maybe I want to give back. How do you know when you are ready, right? So you said a minimum of a year, perhaps more, but how do you know as an individual that this is maybe the right time for me to take that on?
Well, I don't think there's a black and white answer to that. I think it's the kind of thing that you make a decision over time. I always tell patients, make a slow decision. Don't make a fast decision. Don't sign up today, but maybe talk to your counselor, your family, your friends, your sponsor in your 12-step program, and make sure that you're ready to do it. And that's how you do it. And maybe people aren't ready to take a full course load. Maybe it's one, and that's enough.
Oh, that's an excellent
That's
point.
another way to do it. If you haven't been in school for 5 or 10 years, maybe you just want to take one class, and that's great.
Sure.
I always tell my students that as long as you just don't stop, you just keep moving forward, and that you might have a semester where you can do one course. That's okay. I mean, we of course would love it that we have a full-time course load, but the reality is people's lives are complicated. There's a lot of things going on, and I feel like you can accomplish a great deal by breaking big down into small. You just keep moving forward one step at a time.
Sure.
Yeah.
So if a student is really interested and thinks, okay, I think this is the right time, I think I want to go and maybe try to take a class, what is the first class that kind of gives a student the inside training to kind of kick off a program like this?
Well, I often talk to the students about maybe starting with our entry-level human services courses first. For example, our community resources class. This is a course where we have like 9 or 10 guest speakers from the community that come in, and students give presentations about area agencies. I mean, you're learning everything about area community agencies. It's a great way of getting connected with the human services program in general. And we also have an intro to human services just in general course. But at least the community resources class is helpful. Students will also sometimes start with a course we call the CRJ 108, which is the drug and alcohol abuse education course that's taught in our criminal justice program. And that's a very entry-level course into the general addiction field in our program with the addiction recovery assistant. You wouldn't be starting with the addiction counseling right off the bat or the addiction treatment modalities. Those tend to be more in your last semester. Yeah.
Okay. So as you start to think about, I'm a graduate or I'm in the program and I want to get real world experience, you talked about there being different sites throughout the county.
Yes.
What would a student in the program who is at these sites, what would they be doing? What kind of experiences would they have?
Well, for example, I know we currently have at Tapestry Health, which is a wonderful fieldwork site, and they do great work in many different areas, but one of their areas is in harm reduction. And they literally are going out into the field. They're working with clients very closely with their supervisor on various harm reduction skill building activities that they do. So our fieldwork sites are not just about, filing or doing paperwork. It's really actively engaging with clients, individual, some entry-level individual counseling, group counseling. So you're really getting out into the field, but we're very careful about supervision because these are entry-level professionals, and so we're not going to be expecting for you to know more than what you can. So you build over time. And in the social work transfer degree, we have 2 fieldwork requirements, and the second fieldwork requirement is 136 to 144 hours, or 12 hours a week. So we build that experience over time, and we're very much in close contact between BCC and the fieldwork site.
That's great.
Yeah.
Real world experience in a way that kind of allows people to ease in while using the knowledge that they're gaining in the classroom.
And I wonder at the Brien Center, can you talk a little bit about what are some opportunities there for fieldwork?
Certainly. We have a lot of opportunities. We have a lot of different sites. We've had students in our residential programs meeting with the people who live there, but with supervision. And as you said, not overextending beyond their comfort zone and their educational experience. We also have a day program, and students really enjoy that experience because they get to sit in groups. They're not running the groups, but they're part of the group experience. And there's a lot of energy and a lot of sharing that goes on that helps them to learn about the disease of addiction. So those are just 2 places where we commonly have students, but we have a lot of different options throughout the county, and we're in North Adams and Great Barrington too.
Sure, that's great. I want to step aside from the education piece for just a second. If I'm someone at home and I am dealing with addiction, either myself or perhaps in a family or friend situation, you said that this is something that touches everybody in some way, shape, or form. So if I feel like I have a friend or a family member who I think might have an addiction or a problem, as a family member, how do I deal with that? How do I approach that? What's a first step that I can take?
There are a number of first steps. In our community, there's a wonderful meeting Tuesday nights. It's called Learn to Cope, and that's for loved ones of people who are actively addicted. There's also Al-Anon, but there's also a phone call. You can call the Brien Center, 499-0412, and ask for help. And it may be talking to a counselor to figure out what to do about your loved one. It may be talking to a counselor so that you can learn about your options for recovery. We also have a crisis team that can help if it's a crisis situation. And also there's the hospital. Some people need more intensive care and need to go to McGee for detoxification or rehabilitation, which we now have in Berkshire County. That didn't exist a couple of years ago. So we have tons of options, and I always say the hardest part of recovery is picking up the phone. It's the first step, and then it's all there. And if you invest in it, it works.
So it does sound like that would be a pretty big hurdle to get to the point where you think, okay, I need to pick up the phone and call 499-0412.
Yes.
I think that what you said is something that I think hits home with most people, whether it's about addiction or any other sort of life choices. That first step tends to be the big mountain that takes a lot to take on. So this has been incredibly helpful, hopefully for others, but certainly for me. As you start to think about folks who are in recovery, right? So they've gone through a program. What do you see are sort of success rates for folks who have been able to go through those kinds of programs?
Well, if there's enough treatment, and I say evidence-based treatment and long enough treatment, people can do very well. And it's comparable to how people do if they have other diseases like diabetes or hypertension. So it's about 50-50 if you have a new onset of diabetes or hypertension or addiction that you'll enter longer-term recovery. 50% chance that you'll have a relapse of diabetes, hypertension, or addiction. But then you get more treatment. It's not hopeless.
So a cumulative sort of experience when you think about how you're going to take on, whether it is diabetes or it is addiction, that you take the first step if something happens, you take another step, and as you had said, Dr. Dupuis, little bites.
Oh, absolutely. I always feel like you can accomplish anything in your life if you break big down into small, and small accomplishments at each time. It just gets you stronger and stronger to move forward in your life.
Sure.
Yeah.
So with just a few minutes left to go, if somebody is interested in becoming part of this new program for the fall, what should they do?
So I would suggest they could certainly reach out to me. They can reach me. I'll give my phone number, email. Okay. So 236-4506 is my office phone, or my email is kdupuis, D-U-P-U-I-S, at berkshirecc.edu. And of course, also contact the college and speak to the admissions office, and they'll have information there as well. And we have a wonderful group of advisors at BCC who would be more than happy to sit down and talk with you about what are the possible next steps. They will help you with financial aid steps and like what, any of the placement tests that you would have to take to get into BCC, and what are the next steps in terms of registering for classes. But I often will meet with students who are just saying, I've heard about the social work transfer and I'd like more information, and just a face-to-face conversation. I'm more than happy to meet with students.
That's great.
Prospective students, too.
That's great. Thank you so much, Dr. Michaels. Thank you for taking the time out of your very busy schedule to be here. Dr. Dupuis, I know that your schedule is equally very busy between classes and private practice and all the other things we have in life. So thank you both so much. For more information, please feel free to give us a call at Berkshire Community College, 499-4660, and you can learn even more about the program. Thanks so much for being here.